Hello students, welcome to this session. Today we are going to study urine examination. So what is urine? It is formed by kidney. So kidney removes water and harmful substances from blood which body does not want, and then the mixture of water and the waste material forms the urine. So in physiology of urine formation, the important functioning unit of the kidney is nephron. So there are millions of nephrons in the kidney, and the parts of the nephron are mainly renal corpuscle containing glomerulus and Bowman's capsule. So this glomerulus means it is capillary network, and Bowman's capsule, so this capsule filters that urine portion. So the cells and high molecular weight proteins are retained, and the rest things like water and other constituents of the urine like sodium, potassium, calcium and creatinine, urea, other things are filtered in the renal tubule. And renal tubule contains proximal convoluted tubule, then loop of Henle, and distal convoluted tubule. So in proximal convoluted tubule, the urine part which is wanted substances like glucose, calcium, they are absorbed, and then loop of Henle is of two, first descending portion and then ascending portion, and then that continues with the distal convoluted tubule. So in distal convoluted tubule there is reabsorption and secretion, so formation of urea from the toxic ammonia, and then it continues with the collecting tubule, and then collecting tubule continues with the renal pelvis, and then renal pelvis continues with the ureter, and then ureter opens into the bladder, and then when the bladder is full, the urine portion is excreted through the urethra. So this is physiology of urine formation and parts of the nephron. Now we will see functions of the kidney. So in kidney, main function of the kidney is unwanted substances, they are removed. So water balance, acid base balance, electrolyte balance, then waste secretion like nitrogen, toxic substances, then synthesis of erythropoietin. This hormone is secreted from kidney, and it is mainly required for the erythropoiesis, that is RBC formation. Now let's see indication of urine examination. So urine is a common part for the investigations of any patient. So it is mainly for the detection of anatomical and functional abnormality of the kidney. So it may be in case of calculus or stone in kidney or urinary tract, so either in kidney or renal pelvis or ureter or bladder or urethra. Then infection of the kidney like glomerulonephritis, pyelonephritis, urinary tract infection or renal failure. So in that urine examination is important. Then from urine examination we can diagnose multiple diseases, like from sugar we can diagnose diabetes mellitus, from urine like doing bile salt bile pigment test we can diagnose jaundice and differentiate jaundice into different types. Then diagnosis of diabetic ketoacidosis from the urine ketone, then hormone HCG is secreted in the urine, and then diagnosis of pregnancy can be done by determination of HCG, that is human chorionic gonadotropin hormone. Then we can see parasite infection in urine microscopy, or bacterial infection by urine culture. Many toxic substances and drugs are excreted in urine, so that we can do diagnosis of drug overdoses or abuses. Then some endocrine hormones also we can do detect in urine. Then inborn errors like amino acidosis, phenylketonuria, so these are also detected in by doing urine examination. There are different types of urine specimens. So it can be single urine examination, or it can be 24 hours urine specimen. So single specimen, single urine, that is when the patient comes, that is random urine. When the patient comes, you can ask the patient to collect urine sample. Or 24 hours means you have to ask the patient to collect 24 hours urine sample. So from 8 am of one day, so 8 am till the next day, so that is 24 hours urine sample. So this 24 hours urine sample is mainly required for during 24 hours counting of calcium or proteins in nephrotic syndrome. It is very important. Now we will see collection of urine samples. So for routine examination, any random sample, whenever patient comes, you can ask the patient to give sample, that is routine examination, random sample. Then for quantitative test, it is 24 hours urine collection. So in that you have to add preservatives, or you have to keep that urine sample in a refrigerator so that you will not have that bacterial or microbial overcount, or the cells should not degenerate. Then for bacteriological examination, it should be midstream urine sample, that is middle portion of the urine. So you have to ask the patient to clean the parts with soap and water before giving sample. Then you discard few ml of the urine sample and then take middle portion of the urine sample in a sterile container and then discard the later portion of the urine, so that there will be minimum chances of the contamination from the skin flora or from the bladder. And then that sample is to be collected in a sterile container. Then for pregnancy test, early morning sample is preferred, because in that concentration of HCG, that is human chorionic gonadotropin hormone, is more. Then for diabetes, either it is fasting, so without taking anything, that urine sample is collected, or postprandial, that is after 2 hours of the lunch or dinner you can take the sample, that is postprandial. So for 24 hours sample, there may be chances of overgrowth of microorganisms. So to prevent that, we have to add preservatives in a urine. So they are either formaldehyde, thymol, concentrated HCl, boric acid, or you can keep that in a refrigerator. So the role of preservative is to prevent decomposition of the cells of the urine and to prevent overgrowth of the microorganism. So in composition of urine, mainly it is urine formed as mainly is water, and then normally protein, sugar, ketones, bile pigments, urobilinogen, or they are absent. All the cells like epithelial cells, pus cells, red cells, they are occasional. Few crystals you can see, and other components in small quantity like urea, creatinine, sodium, potassium, calcium, chloride, or these things, or cast, they are absent. So it is a normal composition of urine. If anything is in present or in increased quantity, it is called abnormal urine. Now we will see examination of urine. So it is divided into 3 parts: physical, chemical and microscopic. So in physical examination, it is a gross examination. So by observation you have to see what is the volume, color, appearance. Then chemical examination. So chemical examination is by doing chemical test on the urine by using reagents, and then you have to see the color differences, and then you have to find out whether it is positive or negative. And microscopic examination by doing centrifugation of the urine sample, then take that, deposit 1 drop on a slide, put cover slip, and then see under microscope, or you can stain the smear and then you can see the elements of the urine. So that is microscopic examination. So first we will see physical examination of urine. So in that, first is a volume. So normal volume of urine in 24 hours, it is 750 to 1500 ml. So if it is more than 1500 ml in 24 hours, it is called polyuria, and it is seen in diabetes mellitus, diabetes insipidus. Then less than 400 ml urine sample is seen in oligouria, in kidney disorders, and then less than 100 ml urine is called anuria. So anuria means almost absent urine, less than 100 ml in 24 hours, and it is seen in renal failure or renal conditions like glomerulonephritis, chronic glomerulonephritis. Some non-renal conditions are there in which you can see anuria, that is less urine production. So it is mismatch blood transfusion reaction or blood transfusion reaction, or obstruction in by urinary passages by stone. Now second point is color. So normal urine is pale yellow in color because of the urochrome or urobilinogen formation. Dark yellow, it is abnormal, it is seen in jaundice or patient taking vitamin B12 or vitamin B complex medicines. Red or brown, it is seen because of the blood or hemoglobin, or patient is taken beet, so the color changes. Appearance, it is normally clear, but if it is cloudy, it may be because of the proteins, and turbid may be because of the RBC, WBCs or bacteria increase in the urine. Then odor, it is normally aromatic, and fruity odor can be seen in diabetic ketoacidosis. So this diabetic ketoacidosis is a complication of the diabetes. In that, ketones present and odor is fruity. pH, normal urine pH is acidic, and then abnormal, it is alkaline, maybe in infection or triple phosphate crystals. Then specific gravity, normally it is 1.003 to 1.035. It is determined by the urinometer, and that urinometer is calculated at 20 degrees Celsius, therefore correction factor required. So temperature correction factor, so you have to add 0.001 every 3 degree of the centigrade. Hypersthenuria, when the specific gravity is more than the 1.040. So it is mainly seen in diabetes mellitus or nephrotic syndrome because of the sugar and proteins respectively increase in the urine. Hyposthenuria, when the specific gravity is low, less than 1.010, and it is seen in diabetes insipidus because in insipidus the urine volume is increased but either sugar or proteins are not there, so because of that the specific gravity is decreased. So this is a differentiating point. Specific gravity is differentiating point for the diabetes mellitus and diabetes insipidus, because in both conditions you will see polyuria. Then isosthenuria, when the specific gravity is fixed. So this is about physical examination of urine. Here you can see this urinometer. It is dipped in a measuring cylinder. So urine is taken in measuring cylinder and it is dipped in that, and then do not allow to touch this urinometer to the borders of the measuring cylinder, and then you can take the reading and do the correction factor, and then final specific gravity you will come to know. Now we will see chemical examination of urine. So first is protein. So the method is heat coagulation and acetic acid, and procedure, you have to take two-thirds of the test tube in that urine and then heat the upper portion, and then if you see white precipitate, then add acetic acid and then see the precipitate. If precipitate dissolves, then that means proteins absent, and if the precipitate persist or increase in white precipitate, then it is proteins present. The principle is the proteins precipitate when they are boiled in acid solution or by heat. The significance, that is urine containing protein, is called as proteinuria, and they are seen in pre-renal conditions like fever, exercise, shock, then renal condition like glomerulonephritis, nephrotic syndrome, pyelonephritis, nephrosclerosis, and post-renal like pyelitis, urethritis, cystitis, urethritis. So in this diagram you can see this procedure hitting the upper portion of the tube containing two-thirds of the urine. So this is heat coagulation method for the detecting proteins. Now second test in chemical examination of urine is urine sugar by Benedict's test. So in that procedure is you have to take test tube and then take 5 ml Benedict's reagent, that is blue in color, then add 8 drops of urine and then you have to heat it till it gets boiled and then see for the color changes. So in color changes, the negative is blue color, then greenish blue is trace, greenish yellow is 1+, yellow is 2+, orange is 3+, and red or brick red is 4+. So this is the semi-quantitative result of the urine sugar test. The principle is cupric ions present in Benedict's reagent, they are reduced to cuprous oxide by sugar and other reducing substances like glucose, lactose, fructose, and then the color changes according to the concentration of the reducing substances. The glucose present in urine is called as glucosuria, and it is seen in mainly diabetes mellitus or the over intake of the carbohydrates or sugars. Now we will see urine ketone test done by Rothra's test. So in that you have to take 5 ml of urine in test tube, then saturate with ammonium sulfate powder. So saturate means you have to go on adding ammonium sulfate powder till you will get that it is not dissolving and the ammonium sulfate powder is remained in the test tube. Then add few drops of sodium nitroprusside from the side of the test tube and then liquor ammonia from the side of the test tube, and then see for the ring formation at the junction of these two liquids. So if it is purple, it is positive test, it remain colorless, it is negative. The principle is these ketone bodies, that is acetone, acetoacetic acid, butyric acids. So these ketone bodies react with the ammonium sulfate powder and nitroprusside and liquor ammonia and forms purple ring at the junction. The conditions seen in this ketonuria, that is ketones present in urine, are mainly diabetic ketoacidosis, and sometimes you can see in fasting state dehydration, fever, exercise, vomiting, loose motions. So that is dehydration conditions. Now we will see bile salts by Hayes test. So here you have to take 3 to 4 ml of urine in a test tube and then sprinkle bile sulfate powder, that is sulfur powder, on the surface of the urine, and if it is floating on the surface, the test is negative, and if the sulfur particles sink at the bottom, the test is positive. So these bile salts present in urine, they lower the surface tension of the urine, and therefore the sulfur particles sink to the bottom. So conditions when the bile salts are present in urine, they are mainly in jaundice, so either hepatic or obstructive jaundice, but it is negative in hemolytic jaundice. Then we will see bile pigment by Faucett test. So here you have to take 3 ml of urine in test tube, 3 ml of barium chloride, mix and then centrifuge. So that precipitate is filtered, and then to the precipitate you have to add Faucett's reagent. No color change is negative and green color change is positive. So mainly the principle is biles, barium sulfate plus barium chloride, they form barium sulfate, and then the bile pigments form green color after addition of the Faucett reagent. So clinical significance of this test, so bile pigment present in urine, seen in hepatic and obstructive jaundice and not seen in hemolytic jaundice. Now urobilinogen. So here you have to take that 3 ml urine and 3 ml barium chloride. So that precipitate you have to add Faucett reagent, and to the liquid portion, that is filtrate, you have to add Ehrlich's reagent to the supertant, and then see for the color change. If light pink, it is normal, and dark pink or cherry red color, it is seen in urobilinogen increased condition, and that is seen in mainly hemolytic jaundice, or wherever hemolysis because of the mismatched blood transfusion, or hemolysis because of the parasites like Plasmodium falciparum, dengue. So you can see the urobilinogen present, that is dark red in color. Occult blood test. So occult means hidden. So the blood which is not seen by eyes is called occult blood, and it is mainly done by taking that benzene reagent in a equal quantity of glacial acetic acid and hydrogen peroxide, and then add this to the urine on a filter paper, and then see for the color change. If it becomes blue within few seconds, occult blood test is positive, and no color change, occult blood test is negative. So the principle is this hemoglobin acts as a peroxidase, so it breaks down hydrogen peroxide into H2O plus O, that is nascent oxygen, and that nascent oxygen combines with benzene powder and glacial acetic acid and forms blue color. So conditions seen in hematuria, that is blood present in urine, and it is seen in mainly hemolysis or bleeding in a urinary tract. I hope this session you will find useful. Thank you.